Started. Okay, now, as you know, we are going to discuss the quality assessment and the quality control in the clinical laboratory. Uh, the quality outcomes are most important in the clinical laboratory. Okay? We know in the US, maybe each day 10 billion laboratory tests are done and delivered to the patients. And therefore, the quality outcomes are extremely important. Diagnostic, and we also know diagnostic laboratory test results play a decisive role in decision making related to individual patients' care, public health, and research decision, right? You may experience um, when the laboratory decided the COVID test positive for you, okay? Then you have to be under, isolated yourself for 10 days or 2 weeks, right? That means each result uh, of the laboratory test is really important, okay, for decision making. And these are not only for patients, also for public health policies, for research decision, because we we are doing thousands of the research um, um, and decided whether it's correct or not, and we may also created a new rules for that, and therefore um, we we have to design a quality control for lab tests. And now, at the beginning of the quality control, uh, you specify your goals, objectives, and quality requirements, then make a quality plan to manage a clinical lab. As you see in these diagrams, okay, first you have to specify your goals, objectives, and quality requirements. And based on these, you um, design a quality plan, okay? And then you will follow this quality plan, okay? Quality control process, and you have to check your plans time by time, and then you have to assess your quality and then improve your quality as needed. Okay, this a whole a quality management as we see here. Now I am going to talk about it step by step, and I hope that you will understand what does quality management, quality assessment means at the end of these lectures. Okay. Now, the clinical value of the laboratory testing result involve a balancing between the benefit, okay, that a test deliver against any harm that it might cause harm a patients. A balance between benefit and harm is really important. Okay, it is the clinical value of the laboratory testing results involved in such case, and as we see here, harm can be caused by ordering and inappropriate test or not ordering an appropriate test, uh, not using an appropriate test result properly, or delaying or missing a test result from an appropriate test, or reporting an incorrect or inaccurate test result. These all can be a kind of harm that can be um, cause a harm a patient. Okay, quality management works um, at an organizational level to implement an overall quality policy. Okay, quality management cover all issues about the quality, and it's work at organizational levels as the hospitals, okay, or outpatient clinic, and so on. And quality management formalized system document process, procedure, responsibility for achieving quality policies and objectives. Okay? And it involves quality assurance and quality control. Like, what does quality assurance means? Quality control. I am going to share with you. However, to achieve 99% level of quality means accepting 1% error rate. You cannot achieve 100% of the quality. Okay, if you achieve 98, 99% is perfect. Now, the key component to providing a high quality laboratory test result include an educated staff, an appropriate and validated test method, and properly functioning instruments, quality assurance and quality control process, and peer reference proficiency testing. Okay, for total quality, you have to have educated staff, okay, validated test methods, and properly functioning instruments, okay? And you also have to implement quality assurance and quality control process in your lab, and also follow the proficiency testing, which I am going to talk just in a few minutes. Okay, it is most important that specimens be properly identified and collected. As you remember, I told you earlier, okay, identifying and collecting a specimen, a sample, is most important issues that we have to do at the beginning of the process. In some cases, special patient preparations needed. Okay, for example, if you are going to perform glucose tolerance test, you have to prepare the patients 3 days before the test. You have to establish a diet, okay, and then before you load a glucose to the patients, you withdraw a blood, and then you load some amount of the glucose, and then you have to withdraw a blood periodically. Okay, also proper transportation and handling of the samples are also very important for analytical assays. A quality assessment ensure reliability of the results. Okay, it is a total quality of the test that you are performing in the labs, and valid results can be reported only the pre-analytical quality control has been ascertained. Okay, that means uh, the pre-analytical process is really important in the total quality of the test result. Now, CLIA 88 established a minimum threshold for all aspects of the clinical laboratory testing. And nowadays, the introduction of the routine quality control QC in the clinical laboratory was a major advance of improving accuracy and reliability of the clinical laboratory. And errors occurring during the analytical phase of the testing within the clinical laboratory are now relatively rare, because now we implemented the QC in the clinical laboratory, which reduced the error during the analytical phases dramatically. And now there are three voluntary organization, we accrediting organization about a hospital laboratory, and these are the Joint Commission itself, and the COLA, which is the Commission on Office Laboratory Accreditation, and College of Pathologists of American Pathologists, which we call CAP. Okay, these three organizations are about accreditation of the laboratory, okay, and are really important. Now, the first question of this lecture, as you see here, which of the following is not the key component for providing high quality laboratory tests? Okay, to provide a high quality test result, you have to have such key components, okay? But one of them is not the key component. Please go ahead and send your answer to this question. Did you send the answer? I can see it. Okay, two more. Don't be afraid whether it's true or not. No, just we are in a process of learning, right? Okay, see. Okay, the high number of laboratory staff is not a key component for providing a high quality of laboratory result. Okay, the educated laboratory staff, okay, the level of education, the level of experience of the staff is important. However, the number is not important always, okay? Now, please participate to the class discussion. Okay, it is really important for all of us. Okay, I like that you ask question or send uh, answer to this question. Okay, it doesn't matter whether it's true or not. Okay, now it's help you to understand this new information better. Okay, now okay, Lean and Six Sigma are two methods of the quality control that we implement in the laboratory. Okay, these are a pioneering clinical laboratories in the United States that use management system such as Lean and Sigma. Lean, which focus on reducing the waste. Okay, what can be waste? Okay, the time, the number of staff, the um, the um, the amount of the material that we are using, as the name implies, lean. Okay, you may remember from from the people who doing a diet. Okay, the excess to remove the excess amount of the time, excess number of the stuff or material that you are using in the labs. Okay, and Six Sigma, as you see in these diagrams, okay, to define, okay, your goals, objectives, okay, and the procedure that you performing in the lab, and then measure what you are doing, okay, analyze your data, okay, assess your uh, procedure, and then if needed, improve them, okay, and then control uh, all the results. Okay, that means the sigma metric, okay, metric methodology that focus on reducing variability, okay, can have an immediate and recognizable impact when properly applied. Okay, these videos may be helpful to understand what does Lean and Six Sigma means, okay, how we implement this um, um, kind of management system in the clinical laboratory, because you can implement the same management system uh, to any kind of company, any factory, or a hospital or outpatient clinics, not only to the laboratory. Okay, these are a general management systems that nowadays we are using in the clinical laboratory as well. Now, when either of these systems, Lean or Six Sigma, was used to redesign workflow in a high volume core hematology and chemistry laboratory, the result, um, the research showed us that by implementing Lean or Sigma management system, you will be able to reduce 50% reduction of average the test turnaround time, about 60, 50% improvement in laboratory productivity, and also a comparable improvement in the quality of the test result. This is not bad. Only you, I mean, you are doing the same things, performing the same lab uh, procedure methods. However, uh, by implementing one of these lab management system, you will improve the quality. Okay. Now, external standards have been set to ensure the quality of the laboratory results reported through quality assessments and which are um, imposed by CLIA 88 and administered by CMC, Center for Medicaid Service. And the clinical laboratory, as I said before, must be certified by CMC or by a private certifying agency or CMC approved state regulatory agencies. Okay, remember the Joint Commission or COLA or CAP are three agencies that um, um, certify the clinical laboratory. Okay, included in the CLIA 88 provisions are requirements for quality control, quality assessment, the use of proficiency tests, okay, certain level of personnel to perform and supervise the work in the laboratory. Okay, the provisions, okay, to be paid for the test lab that you are doing, there are requirements, okay, which which created by CLIA 88, and these are quality control, quality assessment that you have implement your labs, okay, and also using of proficiency testing. I am going to share with you, and also have a certain levels of personnel to perform and supervise the work. Okay, once you certified from the agencies that I mentioned before, the laboratory is scheduled for regulatory inspections to determine compliance with the federal regulation, including CLIA 88, okay? To be certified is not enough, okay? And your laboratory is scheduled for regulatory inspections, okay? Maybe annually, okay, or twice a year. Now, ways to improve overall errors include at least three strategies, okay, to improve the quality, the total quality of the clinical lab, or to reduce the rate of the errors, okay. There are several strategies, but three of them that are really important: and formal patient safety training, including a discussion of disconnected between laboratory personnel and patients, enhance the communication. Remember, I mentioned it before, communication is really important, like between patient and laboratory staffs and providers, and quality improvement projects that involve patients' outcome data and feedback of the data to the laboratory staffs. Okay. In order to improve the quality, you need a feedback from patients, okay? Also, you need feedback from your staffs. Okay, the good observer that help you to improve your lab quality is your staffs, because they are working in the same space, and their observations is really important to improve each procedure, each method, the total quality of the labs. And therefore, you are using the data from patients, they come from patients, okay? And the feedback of the data of the laboratory staff in order to improve the total quality. Okay, now Six Sigma management focus on which of the followings. Okay, there are two management systems that we are implementing in the clinical laboratory, Lean and Six Sigma. Each of them focus on different area. Okay, now you have to know the Six Sigma focus on which of the following. Okay, go ahead. Okay, don't be afraid. I know I'm waiting that you send all of you send an answer to these questions. We have to make the lecture enjoyable, right? Both sides should make a contribution to this class. Okay, let's see. Okay, Six Sigma focus on reduction of variability in the laboratory test result. Okay, the B is the correct. Reduction of the waste is about lean, okay? And reduction of the variability in laboratory results is about Six Sigma, okay? Good, it doesn't matter whether you send correct, a true or false answer. I don't care about that, but I want you to participate, all of you to participate to these activities, okay? Okay, you also know the phases of the testing, pre-analytical, analytical, and post-analytical. They also known as pre-examination, examination, and post-examination. And you may remember, okay, the pre-analytical phases of the testing is particularly error prone, okay? The spaceman-related errors continue to be a major problems. And then we have to focus on the pre-analytical process mainly, okay? Now, what does proficiency testing means? Okay, one of the clear requirements to use a proficiency testing for your laboratory, okay? A means by which quality control between laboratory is maintained. Okay, in this case, you participate into a program which we call proficiency testing program, okay? And you will receive a specimen sample periodically, okay? And then you will measure these specimens, these samples, and then send the result to the agency that you are a member of the agencies. And this agency will grade your results, how close to the target value, okay? And then also we'll compare your result with other members, laboratory members. Okay, the proficiency testings means that you will participate in a group of the laboratory, okay, which is coordinated by agencies, accrediting agencies, and one of them, and then they send you the same identical specimen sample, okay, a sample which identical to the blood patients, okay, but they send the same sample to each laboratory that that is a member of proficiency testing, maybe 100,000 of laboratory. And then once we receive the sample, we are going to measure these samples, what is included, maybe glucose, cholesterol, ammoniac, or let's see, HIV, viruses, the other laboratory testing. And then we don't know the level of the test, okay? Is unknown samples for us. But the agency knows the level of each test, and they will grade it, okay? They will evaluate our results and also compare it with other labs, and then send their grading results, okay, whether we did correct or not. Okay, now proficiency testing is required by CLIA for non-waiver tests, okay, as a part of verification for tests, whether we are measuring such tests correctly or not, okay, and as a part of process improvement, okay. Once they send us their evaluation, okay, and we will be able to improve our process, okay, by using this evaluation of the agencies, okay. And the CLIA regulations apply to moderate complexity or high complexity assays cleared by and approved by FDA, and also the same test which not cleared or approved by the FDA, but CLIA regulation applied to proficiency testings are moderate complexity and high complexity assays. And these are the proficiency testings is one of the requirements of the CLIA for provision to be paid, okay, to measure the quality of your labs, okay. You cannot say that we are performing our tests and our quality is the best, okay. To do that, to say that such things, you have to be a participant of such proficiency testing. Okay, now, okay, if a laboratory performs only waiver tests, it is not required to participate in a proficiency testing. Okay, per CLIA 88, a laboratory must establish and follow routine QC procedure, quality control procedure. This is required for monitoring and evaluating the quality of the analytical testing process for each methods. Okay, let's say if you are performing 1,000 methods in your labs, for each labs you have to implement a QC procedure, and it is also important to ensure the accuracy and reliability of the patient test result and reports. Otherwise, you are not able to ensure the accuracy of the test results or the reliability of the tests. Okay, clear regulation mandates that any problem or situation that might affect the outcome of the test result be recorded and reported. Okay, quality assessment programs require documentation and computer keeping capability assist in these efforts. If you are using a computer, okay, which has a record keeping capability, that should be enough for quality assurance programs, because clear regulation mandated to document, okay, all problems or changes in the laboratory or changes in the procedure, in the method of the test. Okay, quality assurance verify 3 phases of the laboratory testing, but QC, quality control, only evaluate the analytical parts. Okay, pre-analytical, analytical, post-analyticals, these 3 phases verified by quality assurance. However, the analytical phase verified only by quality controls. And there are 2 types of the QC, quality controls. These are internal and external controls. Internal controls, internal QC also is known statistical QC, that evaluate the daily precision of assays measurements. You are using your own control serums in order to evaluate the precision of each assays in the labs. However, external quality control, external QC, that evaluate the accuracy of assays measurements, and you have to use the external controls. You receive external controls from the proficiency agencies, okay, and this type of the QCs uses the data generated from the voluntary submission of internal QC control assay results from the peer groups, the lab groups that you participated, and also uses data generated from required submission of specific control specimens from the proficiency testing. As I said, if you participate in the proficiency testing, you will receive a sample periodically, and you will measure these samples um, with your instruments and sent to the agencies, okay? And the agency will graded your data, your results. Also, we compare your results with other laboratories, and which is known external QC, because you receive the controls externally, okay? And also your lab results we compare with other lab results. Okay, this is most important than first one. Okay, in order to ensure the total quality of the labs. Now, why it is important to assay control specimens and standards along with the patient specimens? Any idea? You can turn on your mic and share your opinions if you want. Okay, why it is important to assay control specimens or standards with patient specimens? Okay, it is important by assaying control specimens and standards, you ensure that you are measuring the patient specimen correctly. Otherwise, you don't know whether you measurement is correct or not. Now, there are several reasons for that. The first one, detecting errors in equipment, regions, or individual techniques. Okay, there are many source of errors. Okay, it can be from your equipments, your instruments, or the regions that you are using to measure and the patient sample, or individual techniques. Some techniques may be prone to error. To detect such errors, you have to assay the control specimens and the standards, which is known, the level is known. Okay, also confirming the stability and accuracy of the testing when compared with reference values. Okay, your test may be measure, okay, the true value at the date that you also compare with the control serum or standards, but you are not sure whether your test is stable. Okay, maybe in the second day or third day, they will be changed. Okay, and then to confirm the stability of your test, you have to compare the patient results with the control and standards daily, or maybe twice a day. Okay, with the reference values. Okay, detecting an increase in the frequency of both high and low minimally acceptable value, which we call dispersion, also needed to assay control specimens and standards along with the patient specimens. And detecting any progressive drift of the value to one side of the average value for at least 3 days, which we call trends, I am going to discuss with you, and demonstrating an abrupt shift or changes from the established average value for 3 days in a row, which we call shift. Okay, detecting errors, confirming your accuracy, also detecting the dispersion, trend, and shifts uh, required uh, to measure the control serum along with your patient's specimen. Now, accuracy describe how close a result is the true value. Okay, if we have a sample, a control serum that you know the value of a certain test, you can compare your the patient result with which such control serums. Okay, and accuracy describe how close a result in the true values. Let's say you have a control serum for glucose, and the level of glucose in such control serum is 100 milligram deciliter. And now you are using the same sample, okay, and you measuring it twice, 3 times, or several times, okay, and then see how close your measurements to the control level, which means accuracy, okay? And reference sample and standards with known values are needed to check accuracy, okay? To check your accuracy, you need reference samples and standards with known values. Otherwise, you cannot compare your results. Okay, precision, other description that we need to know, describe how close the test results are to one another when repeated analysis of the same material are performed. Let's say to um, to to determine the precision of your test, you are going to measure the level of the test 10 times or 20 times, okay, repeatedly, and then you will see the precision of your data. You will see and how close the test results are to one another's. Okay, precision refers to the reproducibility of the test results. Okay, each time if you get the same, almost the same result, or really close to each other, that means your precision is good. You are doing performing the test correctly. Okay. Now I am going to show you here, and then we will give a break for 5 minutes. Now, as you see in these diagrams here, okay, this is the test results. Okay, here is our target value. Okay, let's see a level of the cholesterol 200 milligram deciliter is these points. Okay, if we have results here, like, okay, far from the target value, that means they are not accuracy, right? But the precision is okay because the results are close to each other. Okay, precision is okay, but accuracy not. Okay, now if we have results like this, okay, the results close to the target value. However, they are not close to each other. What does means precision is not okay, accuracy is okay because the results are close to the target cells. And then now, as you see in this case, the results that you obtain are, okay, not close to each other and not close to the target value, right? Okay, what does means they are both not, the precision is not okay and accuracy not okay. Okay, what we need to obtain, as you see, if we have both precise and accurate results, is perfect. Now they are close to each other, precision is okay, and they're also close to the target value, accuracy is perfect. Okay, if you obtain the test results precisely and accurately, that's fine.
Where did everyone go?
Okay, I hope that I overcome the internet problem. And I have now here, okay, now let's continue with the rest of stuff. Okay, which of the following error is an example of analytical error? Malfunction of microprocessor that affects accuracy in testing is correct answer. Okay, okay, going to clear that. And then, okay, now what does control means? Standard means that I mentioned before. Control represent a spaceman with a known value that is similar in composition, for example, to the patient's blood. Okay, we are using control serum in the clinical laboratory standards, okay, and calibrators, and control represent a specimen with a known value that is similar in composition to the patient's blood. And controls are the best measurements of precisions. Okay, if you know, okay, um, and the level of the samples, which is control, then you are going to measure the same test repeatedly 10 times, 20 times, and see how close one another's, the results, okay? And which give you the precise of the test. Okay, now calibrator or is other kind of the samples that we are using. Calibration is the comparison of an instrument measure or reading to a known physical constants. Okay, standards are highly purified substances of a known composition. Standard may differ from a control because also the control is known. The level of the control is also known. However, the standards may be differ from the controls. Okay, and the standards are the best way to measure the accuracy. Okay, in terms of the standards, you may have different level of the test. Let's say I'm going to show you a low level and high level of the same test, and then you are measure a different level of the same test and see whether how is close to the target values. Okay, and okay, standards are used to establish reference points in the concentration in the construction of the graphs in order to calculate the test results. In most instruments, it is done automatically. You don't need to create a graph, okay, in the clinical laboratory. However, in some rare tests or the tests that you are doing manually, you have to create a graph for each test, okay, by using the standards. Now I am going to show you. Last day I was talking about calibration and standards, but I have experienced some internet problems, okay? Okay, now I am going to talk about the standards. Standards are highly purified substances of a known composition, okay? We are using standards to measure a level of unknown tests. Now I am going to show you here, okay? Let's say if you need to measure the level of the glucose in your samples, in patient samples, okay? And for that, you need to prepare a graph by using different level of the glucose, okay? As you see here, now, I am going to prepare different standards which contain 50 milligram of the glucose, 100 milligram of the glucose, 150, 300, and 500, different concentration of the glucose included in different standards. And then I'm going to measure each of these standards, absorbance of each standards via spectrophotometry. Okay, I know the level of each standards. Okay, now I am here, as you see, I labeled them. And then once I obtain the absorbance of each standard, now I am going to also demonstrate the absorbance of each standard and then created a graph. Now my graph is ready, and then I have a patient samples. I don't know the amount of the glucose in such samples. What I'm gonna do, I am gonna measure the absorbance of the patient samples. Let's say I measured 0.45, okay, and absorbance of the unknown samples. And then here the 0.5 and 0.4 and 0.5, right? Now I am going to come here. Let's see, here is the 0.45, and then the level of the glucose in the patient samples will be 150 milligram deciliter. Okay, if you get the absorbance 0.65, okay, and then you are going to come here and then come down and about 220 milligram deciliters. First, you prepare a graph by using the standards, okay, and then these graphs help you to obtain the level of glucose in each unknown samples. You can prepare such graphs for each kind of lab test. Okay. Okay. Now, sensitivity. Okay. We have 15 minutes. And specificity. You may heard such definitions before, but sensitivity is the proportion of cases with a specific disease or condition that gives positive test results. Okay, let's say you have 100 patients with COVID, okay, COVID patients, and you discover a new COVID test, okay, and you know that these COVID patients, they confirm it by DNA test. You are sure that they are a COVID positive patients, okay? And now you are using your new test to ensure how many of them are positive. If you have 100 COVID patients, okay, and you test these patients by a new test, okay, and if this and the sensitivity means the proportion of cases, okay, with a specific disease, with a COVID, as I give an example, okay, that give positive test means sensitivity. If 90% of your tests are positive in COVID patients, that means the sensitivity of your test is 90%. Okay, specificity is the proportion of case with absence of the specific disease or condition that give a negative test result. Okay, you have healthy patients, healthy population that you are sure that they are not COVID patients, and you take samples from this healthy population and test with a COVID test. Okay, if they are all negative, okay, the proportion of negativity, okay, is the specificity. Okay, let's say you measure, you test it with COVID test, and about 70% of the patients was negative. That means the specificity your test is 70%. Okay, what does mean? Now, what does means if the test has 80% sensitivity? Okay, now if you are testing in a patient's population, okay, okay, for a certain disease, and your test is positive in the patient's group, 80% is positive, then the sensitivity your test will be 80%. If you perform the same test in the healthy population, and about 90% of tests was negative because they are healthy, and the specificity your test will be 90%. Okay, now what does accuracy means? Okay, accuracy, let's see. Okay, how close results are to one another is the precision. Okay, how close a test result is the true value is accuracy. Okay, the correct answer is B. Okay, not bad. Okay, a control is defined. Control is defined. Okay, standard, control, calibration. Okay, let's see. Okay, the control, okay, specimen that is similar to the patient's blood, known concentration of constituents. The correct answer again is B. Okay, comparison of instrument measure or reading to a non-physical constant with other definitions. Okay, the correct answer is B. Okay, now next one, sensitivity. Okay, what does sensitivity means or specificity means? Okay, cases that a specific disease or condition that produce a positive test result. Okay, let's see. Okay, A is the correct answer. Okay, next one. Okay, now go ahead. A quality control statistics, okay? Since that we are talking about the quality, we need to collect data, okay, about the quality results, okay? And this data, in order to get a result, you have to use some statistical analysis. Okay, mean, median, mode, standard deviation, and confidence intervals. Means the degree of a group of numbers, median, middle value of a body of the data. I am going to show you, and mode, the value most frequently occurring in a list of the numbers. Okay, the standard deviation, okay, is a measure of the variability in a data sets. Okay, and confidence intervals is a reference range expressed as 95% or two standard deviation on either side of the means. Now I am going to show you here that as you see what does mean, okay? If you have a that data sets like these, you are, okay, you sum up all these data, these numbers, since there are 5 different data, okay, and then you divide it by 5 and get a mean value, okay. If you sort these data from lowest to the highest, okay, the median will be the number in the middle of the list, okay. And if you sort the same data from lowest to highest and see the frequency of the data, the highest frequency of the data will be the mode. As you see in this case, 72 is the mode of this data set, okay? Now, we know that statistically, the reference range of a particular measurement in most cases show a bell-shaped curve. Okay, this Gaussian curve or Gaussian distribution has been shown to be correct for virtually all type of the biological, chemical, and physical measurements. Okay, the distribution of all values around the average for the particular group measurement is described statistically by standard deviation. Okay, you have a average value, okay, and the data around the average value, above or below the average value, is known standard deviation, deviated from the average value. Okay, now as you see here, which we are using in the quality control statistics, these bell-shaped graph, Gaussian distribution. Here are a average value, X, okay? And then one standard deviation to standard 3 standard deviation, okay? If you accept one standard deviation, okay, in the both sides, and the confidence interval will be 68%. What does means your data will fall in between these two standards in 68% of your data will fall in this range. Okay, about 32 points will be out of your range. If you accept 2 standard deviation, about 95% of your data will fall between this range, okay? 5% will be out of the range. What does means your confidence interval will be 95%, okay? If you accept 3 standard deviation, then 99.73% your data will fall between these range, 3 standard deviation, okay? Only a few of them will be out of the range. Now, okay, if we need to monitor the quality control, to the quality of your test, okay? In most cases, the instruments, they are doing by itself this, but in some case, we are using Levy-Jennings QC graphical data plots in order to identify unacceptable runs, then evaluate the source of and magnitude of the deviation to decide if results are to be released to the patient charts. Okay, now the Levy-Jennings graphs help us to follow the quality of our test. As you see, this is here our target value, okay? It depends on the lab which standard deviation is accepted. If the 1 standard deviation, 2 and 3 standard deviation, usually the labs accept 3 standard deviation. That means your confidence interval is about 99%. Okay, as you see, these results is out of control, higher, and higher, okay? And here you see these results, okay, is out of control because is out of the range of the 3 standard deviation, okay? And you see here imprecision, okay? And drift, as you see here, a sudden increase of the lab data, okay? Each of them has a different meanings. No? Okay. Okay, now we still have 20 minutes, okay? And if you want, I am going to stop in a 5 minutes and then give access to the quiz 1, okay? This is one option. A second option, I am going to continue at the end of the lectures and give access to you at 6 p.m. today. Which of them works for you best? In a 5 minutes, okay, 1:45 p.m. or 6 p.m.?
1:45.
Okay, okay. Now I am going to...
Or 6 p.m.?
Yeah, either 6 p.m. today or 1:45, I mean, in 5 minutes. Okay.
1:45 is fine.
Okay. What about you, Trinity?
Yeah, that's fine.
Okay. Okay, now I'm going to finish in 5 minutes and then you will get access to that, okay? Now, what does shift means and trend means? Now I'm going to show you with a graph. Okay, a shift is defined as sudden and sustained change in one direction of control samples. Okay, now you are measuring amount of enzymes as a control sample. And as you see, your results, okay, I mean, at the day of 8, after date of the 8th, they are on the same sites, always, okay, and which is known as shift, okay. A sudden and sustained change in one direction, okay. As you see, okay, they shift to the below of the medians, and then they sustain it at the same site uh, at least for 3 days. Now, trend or drift is a gradual change in the control of the samples. As you see, is gradually decreased day by day. It started with day of 11 and then decrease it gradually. Each of these changes has a different meanings in order to find out the source of errors. It may depend on the because of the regions or because of the instrument, or it's based on the methods, the techniques that we are using. Okay, now Westgard rules. Okay, this is my last slides. Okay, we are using Westgard rules to accept or reject the test. Okay, which improve the quality of the test results. Okay, now I am going to show you here. Okay. Maybe, okay. Okay, the Westgard rules define specific performance to detect both the random and systematic errors. Okay, and there are different rules of the Westgards, warning rules, okay, and also the violation of the rules, as you see here, okay. If as you see here, if you accept 2 standard deviation, as you see, one of your control is out of the range, okay, is violated your rules, okay, the Westgard rules. However, in the same day, in the other control is normal, okay. Therefore, this we call as warning rule, okay, and you will accept this, okay. The warning rules, only one control is out of the range, other is normal, okay. If you have a result which is about 3 standard deviation, okay, which we call 3S rule, then you will reject the result. You don't release the patient's results, okay? Now let's stop here.